Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right 4, 5, and 6, and the lower right 4, 5, and 6. Now we're going to concentrate on the upper right 4, 5, and 6 first. On the transaxial view, this is the upper right 6. The upper right 6 does not show any signs of cracks. We do see sinusitis here, but we don't see any J-shaped radiolucency. We don't see any crack extending. This tooth does have MB1 and MB2. We don't see anything in the parietal root, and we don't see anything in the distal canal as well. We do have a abstraction lesion right here, which can be visualized here. And because of this abstraction lesion, there is a line extending, but this cannot be a crack. But we do see that there is a ingress from here towards the pulpon, which can be seen right here. Now moving to the upper right 5, the upper right 5 has a curved root. On this curved root, we don't see anything major problematic, but we don't see any major periapical radiolucencies. We don't see any cracks on the transaxial view. Moving to the upper right 4, the upper right 4 again, we don't see any cracks here, but there is PDL widening around this tooth, and we can see a little bit of a radio lucency developing around the 4. Now moving to the axial view. The axial view is basically the top to bottom view. So here we see a line extending from the distal aspect of the 6, and as we move slightly superficially, we see a line extending right here in the upper left 4. So we would say the upper left 5 does not show us any major signs, but other than this line here. But we really need clinical symptoms so that the doctor can guide us. But as far as this is concerned, we've shown you the upper left 4 shows a line extending from the mesial to the distal. There is a line in the upper left 5 and the upper right, 5, but it's very faint. But upper right 6 has a major line here extending into the pulpon. And then as we move inferiorly towards the crest of the bone, we see that there is a little bit of a radiolucent shadow developing here around the 4, and PDL widening here around the 4, which we don't see in any other tooth. In the lower right 4, this is the lower right 4 transaxial view. We can see a cavity developing just underneath the enamel, but we don't see any cracks in the lower right 4. The lower right 5, however, we can see a cavity developing, and along with the cavity, we can see a major crack line right here. So you can see that there's a crack line extending from the from the groove all the way to the apex. So this tooth definitely has a crack, which is the lower right 5. Moving to the lower right 6, the lower right 6 again, no major cracks can be seen or major periapical radiolucencies can be observed. If we look at the axial view, which is basically the top to bottom view, so here again, if we go slightly higher, so this is where the crack we can see in the lower right 5. This is by far the most evident crack that we've seen in any of the teeth, major, be it upper or lower. So the lower right 5, definitely. The upper right 4 most likely shows a crack, and the upper right 5 and 6 will need clinical correlation, because we do see faint signs but nothing very conclusive. Thank you very much.